A newly identified coronavirus that emerged in the city of Wuhan in central China is now known to be transmissible between people. There have been a number of deaths reported and hundreds of infections around the country, and the number of confirmed cases outside China is growing. But what is a coronavirus? There are many coronaviruses found in animals, but only about 6 are known to affect humans. The strain discovered in Wuhan has been found to cause severe lung disease. The first reported human infections were among people who visited the seafood and meat wholesale market in the city. It has since been closed by health officials. Only a block away from one of Wuhan's major train stations, the market reportedly sold a range of animal meat, including peacocks, koalas, Chinese giant salamanders, masked palm civets, and bamboo rats. The location as well as timing of the outbreak are causing great concern. Wuhan is a major transport hub in central China, and the spike in cases started just ahead of a massive travel rush for the Lunar New Year. It is known as the biggest annual migration of people on the planet. The infection has already turned up in Hong Kong, which was hit hard by an earlier coronavirus originating on the Chinese mainland. The deadly coronavirus known as Severe Acute Respiratory Syndrome, or SARS, paralyzed the city in late 2002 and early 2003. That experience has people in Hong Kong quickly ramping up protective measures. Doctors are reminding patients to avoid crowds as well as contact with animals if possible. After touching surfaces in public areas, good personal hygiene should include washing hands for at least 20 seconds with soap and water, or at least a hand sanitizer. Face masks may help, but as demand rises, some pharmacies are limiting purchases to a single box. Hong Kong authorities have already earmarked 2 sites to serve as quarantine centers. Some health experts have suggested that the mortality and infection rate for this coronavirus is, for now, less worrying than it was during similar outbreaks in the past. But as the number of cases around the world continues to rise, governments and health professionals are preparing for the worst.